that are the key points. Now, at the moment, we have enough scientific proof that take 20 years to prove that indeed with early detection you can reach mortality reduction more than 20%. So in the two main powered studies, so the Nelson study and the NLST, the American and the European study, those two studies are the only two that are powered enough. So there are many, many other studies, but their outcomes have not enough power to prove that there is mortality reduction by early detection of lung cancer. So that is, I think, the moment where we stand. And lately, last year, the US Task Force, the US Preventive Task Force, has decided to change their recommendations because of those outcomes of the Nelson study that we published in the New England Journal of Medicine. And they regarded the advice was that there was moderate evidence for the implementation of lung cancer screening in the US, of course. And now they changed it because of the Nelson outcomes, that there is now enough evidence and they recommended too high. So now, precisely 1 year ago, in March, they came out with this recommendation, and they literally also referred to the publication in the New England about the Nelson data. And there they said the recommendation for implementation is now high to implement it. So now they are really starting in the US, and they are also at the moment reimbursing lung cancer screening. So we are not that far here. So Medicare is reimbursing lung cancer screening for the Americans that are eligible, of course, to do early detection of lung cancer screening. But in Europe, we are not that far. So, one of the major things that we will state is that we are now on the brink at the moment to start implementation. And this year, so that is more or less a follow-up of the Nelson study, we will start with a large European study, and that is an implementation study, so not to prove that there is mortality reduction, but to investigate what is the best way to implement lung cancer screening in Europe. And we will do that in several countries. It will start this year. So Netherlands is in the lead, but we will collaborate with Germany, with France, with Italy, with England, Spain, so many countries. And there they will also start with the first thousands of including for those studies to do early detection and look in the populations which effects are there. We will monitor it, of course, also, and we will also look at what they call incidental findings, but we think that it is important also to include in a regimen of early detection. And that is that we also will do early detection of emphysema and cardiovascular disease in one test. And that is part of this research implementation study that is funded by the European Research Council.